Hello guys and welcome to our YouTube channel Patholab, and this is the 5th episode, which is going to be about Graves' disease, one of the most important autoimmune endocrine diseases. I am Dr. Lisa Ahmati, 4th semester student in Tehran University of Medical Sciences, and today I'm going to briefly explain this condition. Graves' disease is also known as a Basedow disease, and it is also the most important form of hyperthyroidism. Let's talk about the triad of clinical findings. Number one condition of hyperthyroidism is due to diffuse hyperplasia of the thyroid gland, but the second condition manifestation is infiltrative ophthalmopathy, which will actually result in exophthalmos. You can see an image of this condition right here. The third clinical manifestation is localized infiltrative dermography in a few of the patients. The peak of the age that people can get this disease is between 20 to 40 years of age, and females are 10 times more prone to this disease and condition than males. Now let's talk about the etiology. Graves' disease, or hyperthyroidism, or Hashimoto's disease in comparison, which is hypothyroidism, are two very extreme autoimmune diseases of the thyroid gland. The first reason can be genetic factors. Graves' disease has a very strong component of genetics, and it is supported by following observations. For example, co-occurrence of the same disease in a monozygote twin, or the other twin, which is asymptomatic, or your sibling, also has, for example, anti-thyroid antibodies. This mostly happens in Hashimoto disease, or it could also have association with other autoimmune diseases. Now, genetic susceptibility for Graves' disease is mostly associated with polymorphism in genes that are associated with immune regulation. For example, let's say cytotoxic T lymphocyte regulation, which is an antigen 4 or CLTA4 gene. Now that we know the etiology, let's talk about pathogenesis. Now, about pathogenesis, number one is thyroid stimulating immunoglobulin. Now, this is the most common one, where you have an immunoglobulin or an IgG antibody that binds to your TSH in your thyrocytes, and all patients almost show this antibody, and it is very specific for Graves' disease. So if someone has anti-TSH immunoglobulin or antibody, it is a very important decision that you make that this person would most definitely have the Graves' disease. Also, they are antagonists and stimulate the TSH hormone, so because it stimulates TSH, you will have more secretion of T3, T4 or thyroid hormones. Number two is an immunoglobulin that stimulates, not TSH this time, rather thyroid growth stimulating hormone. Now, it will actually make the proliferation of the thyroid gland itself, that means more cells, so more production of thyroid hormones itself. Now let's talk about morphology. In this picture, you can see that the thyroid gland is symmetrically enlarged due to diffuse hypertrophy and hyperplasia of thyroid follicular epithelial cells. The weight of the gland has increased, and in the cut section, it appears soft and meaty, resembling a normal muscle. However, in this microscopic view of the right thyroid follicles are seen as crowding of epithelial cells, which are tall and more crowded than a normal gland. Also, small popular fibrovascular cores are seen, and they are projecting into the lumen. Colloid is also pale with scalloped margins, and lymphocytes inflammation is also seen. Now that we know what this disease looks like and also the clinical features, let's see what laboratory diagnosis can help us diagnose these patients. We can see elevated free T3 and T4, and because of the negative feedback, we can see decreased levels of TSH. However, if we look closely, you can see an increased uptake of iodine, and also your radioactive scans show a diffuse uptake of iodine, and it is because of the continuous stimulation of stimulator immunoglobulins that are similar to TSH or thyroid growth stimulator. In this video, we had covered the Graves' disease, clinical manifestations, laboratory findings, and also the etiology. Now, you can see also that we also covered the microscopic and microscopic view of the changes in the thyroid gland. If this video has been educational for you, please like and subscribe to the video, which gives us motivation to make more of these videos for you medical students.